Okay, good morning, everyone. We are going to call the May 5th Tuolumne County Board of Supervisors meeting to order. Before we start this morning, I'd like to have just a moment of silence. Larry Rotelli passed away last Friday. Larry served on the Sonora City Council. He was mayor for the city, and then he served 5 full terms on the Tuolumne County Board of Supervisors. Larry was a real fixture in Tuolumne County politics. And Dixie, know that this morning we are all praying and thinking of you and your family. Please join me in a moment of silence. Thank you. All right. Will the clerk please read our public participation procedures?
So, in order to protect the public health and safety of Tuolumne County citizens, the Board of Supervisors meeting will be physically closed to the public, but it is available as follows. The public access video and audio live streaming is available on the Tuolumne County website at www.tuolumnecounty.ca.gov. Public access audio only is available on a Zoom meeting for listening purposes only. You can call into 1-669-900-9128, and the web ID number is 987-3738-5155. And the meeting will be open to the public via remote line. So during the meeting, citizens who wish to comment on an item publicly should call into 533-6581, and the call will be taken in the order it was received. So the public comment will be open and closed individually for each agenda item, excluding staff reports. And I'll remind the public periodically as I'm reading through the agenda, the call-in information. So please call in when I read the item, and the chair at that point will ask for public comment, and your call will be taken in the order it was received. But I also wanted to remind the public there's a 30-second to 1-minute delay, so that's really important to call in when I read the item if you wanted to speak on it. Thanks.
So at this time, if you're interested in speaking oral communication, please call in. And if you would please join me in a salute to our flag. Ready, begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, at this time, I'd ask if there is any oral communication. Remind the public that they may speak on any item that is not on the printed agenda, and please keep your comments to 3 minutes. Okay.
Okay.
Good morning, Chair Brennan, members of the board and county staff. This is Lisa Mayo, President and CEO of Visit Tuolumne County. And this week is National Travel and Tourism Week, and this month is California Tourism Month. And while we're all faced with incredible challenges right now, I think it's a fitting time to reflect on the importance of Tuolumne County's tourism industry by sharing with you some good news from the 2019 Travel Impacts Report that was just released by Visit California yesterday. In 2019, travel spending in Tuolumne County increased to $273 million. That's a 7% increase over 2018. The California state average was 3.2%. State and local tax receipts from travel spending increased 8.7% last year to $21.3 million. State and local tax revenue is equal to $960 per Tuolumne County household. And tourism in Tuolumne County supported over 4,000 jobs in 2019. Tourism is one of the most resilient economic sectors, and Visit Tuolumne County and our partners from locally to all around the world are committed to bringing back Tuolumne County's thriving tourism industry. And while travel really isn't happening at this moment, it will be back, and we know that the spirit of travel is alive and well. So Tuolumne County's travel industry, and I thank you very much for your continued support. And thank you for this opportunity to speak with you while it's not face-to-face, via telephone today for public comment. Thank you.
Thank you. Is there any other public comment? No? All right, thank you. At this time, we will do staff reports. The staff may present public service announcements, project updates. Please.
Good morning, Chairman Brennan, Ms. Riggs, members of the board, and Ms. Carrillo. Lori Darby, Program Manager, Department of Social Services. This morning I wanted to share with the board 2 community assistance programs. The cost of food has impacted many families in our community, and these costs are further increased when COVID-19 closes schools and the stay-at-home executive order was issued. While children who were being fed at school continue to receive school lunch meals, families have the added expense for those who are not yet in receipt of their unemployment benefits. To assist families with these costs, the California Department of Social Services, in partnership with the California Department of Education, funded by the United States Department of Agriculture, have implemented a food program called Pandemic EBT Food Assistance. Eligible families may receive, I have allergies really bad this morning.
Sympathize.
I know, I feel like I can't breathe. Anyway, eligible families may receive a one-time benefit of up to $365 in food assistance for each child living in the home. Most families receiving public assistance, such as CalFresh or Medi-Cal, or prior to the school closing, will automatically qualify for the pandemic EBT and should receive these benefits between May 12th and May 22nd. Families who started to receive public assistance benefits after the schools closed will receive pandemic EBT benefits by June 30th. Families who are not receiving public assistance but qualify for free or reduced priced school meals may apply for the pandemic EBT. The pandemic EBT online application will be available in late May. Pandemic EBT benefits may be used at traditional grocery stores as well as farmers markets. The second program, although not under our jurisdiction of our department, comes as a result of many of the residents having difficulties maneuvering through the online process of applying for their unemployment benefits. Currently, the only assistance provided to residents is via the telephone. As a courtesy to our community, our department is available to help any resident who needs assistance applying for unemployment benefits. We will help them complete the paper application, fax applications, or help them with the online process. We are available for in-person assistance and no appointment is needed. We're also available by telephone at 533-5711. Thank you.
Thank you. Any other staff reports? All right. Will the clerk please read the consent calendar?
Minutes of the meeting held on April 21st and 23rd, 2020, approving a license and release agreement with the State of California Judicial Council for parking areas on the Law and Justice Center campus. authorizing the Tuolumne County Fire Department to apply for Firehouse Sub Public Safety Grant Foundation Grant, approving the application for the staff for adequate fire and emergency response grants for the purpose of recruiting and retention of volunteer firefighters for the County of Tuolumne, approving the establishment of a $20 annual fee for fiscal year 2020-2021 to administer and defend Chapter 5.28 of the Tuolumne County Ordinance Code. This is control of rents and mobile home parks. Accepting the resignation of Annie Hawks from the First 5 Tuolumne County Commission and directing the clerk to send a letter of appreciation and post a notice of vacancy. Adopting a resolution proclaiming May 2020 as National Preservation Month in Tuolumne County. Adopting a resolution proclaiming May 3rd through 9, 2020 as Wildfire Preparedness Week. Adopting a resolution proclaiming May 2020 as Mental Health Month. Adopting a resolution proclaiming May 2020 as Foster Care Month. Accepting the resignation of Jerry Tannhauser from the Fire Safe Citizens Advisory Committee and directing the clerk to send a letter of appreciation and post a notice of vacancy. And then next two are as the Air Pollution Control Board, and that is adopting a resolution authorizing the district participation and the Air Pollution Control Officer to execute an agreement with the California Air Resources Board for the year 22 Carl Moyer program, and the other one is approving a wood stove reduction program memorandum of understanding between the California Air Resources Board and the Tuolumne County Air Pollution Control District, authorizing the Air Pollution Control District officer to sign. And if you'd like to comment on these items, the phone number is 533-6581.
This time I'd ask if there is any board comment or if a member would like to pull an item.
Madam Chair, I would like to pull item number 12.
All right. Any others? And I would just make a quick comment. I served with Annie Hockett on the First 5 Tuolumne County Commission and would like to thank her for her service as all of those that serve on our boards. We get so much done in Tuolumne County because of the service of so many. With that, I'd ask if there's any public comment. All right. I'm looking for an action.
Madam Chair, I move on the consent agenda, absent number 12.
Second.
I have a motion from Supervisor Rotifer, a second from Supervisor Gray. All those in favor?
Aye.
Aye. Any opposed? Motion carries 5-0. Will the clerk please read item 12?
This is accepting the resignation of Jerry Tannhauser from the Fire Safety Citizens Advisory Committee.
Supervisor.
Madam Chair, I wholeheartedly agree and endorse your previous comments with respect to everyone that serves on our committees and commissions in this county. It is impossible to do business without them, and they all add a tremendous amount of value to our county and our county government. The reason I pulled item number 12 is because Jerry Tannhauser, among a very large and distinguished group, actually really does stand out. And he has done more for fire safety in this county than 99% of the people in this county. There are others, but there are very few, a very small handful that have contributed as much to the public safety of our county and our residents as Jerry Tannhauser. And I just wanted to recognize him and thank him especially for everything that he has done. He will be sorely missed, and I am looking for, since he is my district representative on this, I am looking for volunteers, and I'm hoping to find someone that will step up. So please, if you are interested, do apply. But Jerry, thank you so very much for everything you've done for our county. And with that, I move to approve number 12.
Second.
All right. I'm going to give the second to Supervisor Campbell. I'd ask if there is any public comment. Seeing no public comment, all those in favor?
Aye.
Any opposed? Motion carries 5-0. Thank you, Supervisor. I wholeheartedly concur with every statement that you made. All right. Will the clerk please read our 9:15 appointment?
This is consideration of adopting a resolution proclaiming May 15th, 2020 as Peace Officers Memorial Day and May 10th through 16th, 2020 as National Police Week in Tuolumne County. And the call-in number for comment is 533-6581.
Good morning, Madam Chair, members of the board, Bill Pooley, Sheriff of Tuolumne County. I'm happy to be here today to present to you a resolution proclaiming May 15th as National Peace Officer Memorial Day. As you know, law enforcement plays an important role in our society and our local community in protecting and serving those in need from those who would do them harm. As such, it is often a very dangerous career, sometimes ending with the tragic loss of men and women who have lost their lives while protecting others. To honor law enforcement officials who have lost their lives protecting and serving their communities, President Kennedy proclaimed May 15th as National Peace Officer Memorial Day, and the calendar week in which May 15th falls as National Police Week. Established by a joint resolution of Congress in 1962, National Police Week pays special recognition to those law enforcement officers who have lost their lives in the line of duty for the safety and protection of others. So I ask that you join our state and the nation in the Honorable Declaration of Peace Officer Memorial Week and proclaim May 15th as National Peace Officer Memorial Day and the week which it falls in as National Police Week. As we're unable to do our annual Peace Officer Memorial where we have the community down and honor those who have lost their lives, we have prepared a short video to honor those folks, and I hope that you would indulge me for a moment. So I would like to thank you for your time and invite the Madam Chair down to read the resolution.
And before I join you at the podium, I'd like to give my fellow supervisors an opportunity to make any comments, because I know this is an event that we all really do. We attend this every year, and it's a very sobering reminder of what our officers go through every day when they step into the uniform and go to work. So as I make my way down, Supervisor.
Yeah, always moving, Sheriff, and, you know, what police officers do, putting their lives on the line for us, is something that I don't think, unless you're in that position, understand it. So I thank all in law enforcement. Thank you.
Thank you.
Tough day when we have that ceremony, and I'm going to miss that terribly. I don't want my comments to seem like I don't value every single law enforcement officer and what they do. I do. But very often we forget that behind a lot of them are their families. And when we honor those that have fallen, those families remain behind and are forever ever damaged by the loss of their loved ones. So every bit as much as the officers that are out there, men and women, are their spouses and their children and their families. And I think that we should remember, and we always do, in such a moving ceremony, the sacrifices that those officers make. But I think we ought to also remember the sacrifices that their families make. God bless them all.
Thank you.
Yeah. And I agree with those comments. There's very little I could say that would add or subtract from the sacrifices that peace officers have made in the line of duty. And it's not something that I think most people think about on a day-to-day basis, but it's there every day, 24 hours a day. The guardians of our civil society are out there putting their lives on the line, and without them, we couldn't enjoy a peaceful and free community like we have. So it's I too am. I miss having the event that we typically have, because it's a worthwhile time to set a little bit of time aside for the people that have made sacrifices and that risk everything to keep our community safe. But they're out there working right now and doing their jobs. So it's good to just take some time and think about that and remember it and appreciate it.
Thank you.
So I'm not muffled. No, it's one thing to wake up and go to work every day. I mean, our lives are all numbered. But as you know, it's another thing to wake up every day and know that that could be the end of your shift. And it takes somebody very special to do that. It's a calling. And I'm gonna miss that event. But law enforcement is a front line of our civic society. And when we talk about budgets, when we talk about basic constitutional functions and duties, it all comes down to maintaining a civil society. And you can't do that if you don't have folks who are willing to go put their lives on the line and do this kind of work. So it's a whole new day and age with law enforcement, with the public scrutiny, with the policies that come down, with so many legal hoops and litigation. And so law enforcement is under the gun, and they have a lot of weight to carry on their shoulders. So thank you guys. I know some of the deputies up here.
No, I don't.
Publicly thank them. And every deputy I know that I've come across is sincere, hardworking, and just wants to do good for their family and good for this community. So thank you guys, and I will miss that event, but I look forward to hopefully next year.
Thank you so much for your kind words, everyone. I do have a copy. I apologize.
So please bear with me as I read this resolution. Whereas law enforcement plays an important role in our society and community, and whereas the officers who choose this brave and dangerous career are risking their lives to serve and protect our citizens, and whereas numerous men and women have lost their lives in the line of duty, And whereas National Police Week was established by a presidential proclamation in 1962 to recognize the hazardous work, duties, and responsibility of our nation's peace officers. And whereas May 15th is observed annually as Peace Officers Memorial Day to commemorate the sacrifices and commitment of the officers. And whereas Tuolumne County Sheriff will observe Peace Officers Memorial Day on May 15th, and due to the current social distancing guidelines, a video memorial will be shown in lieu of a public memorial. Now, therefore, be it resolved that the Board of Supervisors of the County of Tuolumne does hereby designate May 10th through May 16th as National Law Enforcement Officer Memorial Week and May 15th as Peace Officers Memorial Day in recognition of the peace officers who have given their lives in the line of duty. I would ask all of our citizens that if you see a peace officer, not just during this week, but anytime, thank them.
Thank you all for your kind words. Thank you.
Madam Chair, I move to approve the resolution.
Second.
I have a motion from Supervisor Rotifer, a second from Supervisor Gray. Is there
done
any
public
public comment? Seeing none, all those in favor?
Aye.
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 Any opposed? Motion carries 5-0. Thank you. So we have just a few moments before our 9:30, so will the clerk please read item 15?
Consideration of approving an agreement with Sierra Vista Hospital for inpatient psychiatric services.
Good morning, Madam Chair, members of the board. Michael Wilson, Behavioral Health Director with Health and Human Services Agency. And the item I have today, as was just read, is the agreement with Sierra Vista Hospital for inpatient psychiatric services. Tuolumne County Behavioral Health Department is responsible for the provision of specialty mental health services of seriously mental ill individuals that are eligible for Medi-Cal or uninsured. Behavioral health is responsible for the cost of inpatient psychiatric hospitalizations per regulation. Every effort is made to contract with psychiatric inpatient hospitals closest to Tuolumne County. California Department of Health Care Services requires that counties enter into contracts with facilities when there is a consistent use to assure agreed-upon rates and reimbursement. Sierra Vista Hospital is a 120-bed facility located in Sacramento and is consistently used by the Behavioral Health Department to increase accessibility for children and adults. Behavioral Health has contracted with Sierra Vista Hospital inpatient services since June of 2013. An agreement between Behavioral Health and Sierra Vista Hospital in the amount of $300,000 per fiscal year was executed on July 1st, 2017, and ended on June 30th, 2019. The attached agreement will allow Behavioral Health to continue to utilize Sierra Vista Hospital to provide the much-needed psychiatric inpatient services. There will be no cost to the general fund related to this agreement. The funding has been budgeted in the Behavioral Health fiscal year 2019 to 2020. Adopted budget. The agreement will not exceed $300,000 per fiscal year. It is respectfully recommended that your board approve the agreement for acute psychiatric hospital inpatient services between Behavioral Health and Sierra Vista, commencing July 1st, 2019, not to exceed $300,000 for the fiscal year 2019-2020, and authorize the county administrator to sign the agreement and all related documents.
Are there any board questions? Is there any public comment? All right, we'll bring this back to the board.
Thank you.
I'm looking for an action.
Madam Chair, I'll move on staff recommendation.
No, second.
A motion from Supervisor Rotifer, a second from Supervisor Campbell. All those in favor?
Aye.
Aye. Any opposed? Motion carries 5-0. Thank you. All right. At this time, we will go to our first 9:30 appointment. Will the clerk please read that?
Sorry. This is a presentation and planning status update on the coronavirus COVID-19.
Good morning, Madam Chair, members of the board, Ms. Carrillo, Ms. Riggs. My name is Rebecca Espino, Health and Human Services Agency Director. Today's introduction will be brief because our public health department put together a very robust presentation. We want to make sure we get through it. Also, Dr. Ortiz just received a text that she has an emergency 10 o'clock meeting, so web meeting, so we will get through it as quickly as possible and ensure the board and the public has an opportunity to ask questions. But before the presentation begins, I want to continue to take this opportunity to thank the entire public health team for their exceptional work and for all our partners, because it takes a true community effort to manage this crisis. I also want to thank Madam Chair and every member of the board for keeping us on our toes, because we know at the end of the day, you only have this community's best interests at heart, and we do appreciate that, even though sometimes it feels like we don't, but we do. We know that you really, really care about this community, and you make sure that we're doing the best work we can every single day. Thank you.
Okay. Christina Herrera and I are known for doing really fast presentations, so buckle up. All right. Some of you guys should know this basic information, but just an example for the public of the numbers compared from this past Sunday to what we presented to you 2 weeks ago. So we have not quite doubled cases for the U.S. And California. In Tuolumne County, we currently have 4 positive cases of residents. 2 of those have fully recovered. We have 0 current positive cases for non-residents. We had previously had 2 non-residents who had been tested at Adventist Health Sonora that were not residents, and their cases have been assigned to their counties of residence, as we normally do for all of our disease reporting. So I wanted to talk a little bit about the difference that in cases around us. We know that when we look at the state numbers, they're largely influenced by what is happening in the Los Angeles area, and the metropolitan area down there is the biggest influence for California numbers. But we look very closely to what is happening in the Central Valley and the counties to the north and south of us. And so just to point out that as of when we last pulled this table together, which is not this morning, Tuolumne County had stayed steady at 4, Mariposa had gone up to 14, and Stanislaus is over 400. So it's a little bit easier to look at in a colored map. And in the next map, we'll kind of zoom in a little closer to the counties around us. But as you can see, before we had a little bit more of a buffer zone around us, which we don't currently have. And Mariposa was holding steady at 0 for a very long time, but very quickly went up to 14. So we know that San Joaquin, Stanislaus in particular are areas where we all travel to and from frequently, where people come up here for recreation and for work. And the disease behavior in the Central Valley is something that is one of the most important things that I look at when I'm trying to determine what is the risk in Tuolumne. Although in Tuolumne at this time, we have no evidence of community transmission.
Liza, just for the public.
Yep.
On a previous slide, you don't have to go back, but we had 4 positive cases, 2 had recovered. The other 2 are recovering outside the county, just for the public's information.
Yes, that is correct. Just a reminder of our regional partnerships, because obviously this virus doesn't care about county lines, and it's important for a lot of reasons for us to be doing things with our partners around us. So we continue to participate with the Yosemite Gateway Area Coordination Team. speaking with them multiple times daily. We also coordinate with the San Joaquin Valley Public Health Consortium, which includes several counties around us and the valley. And both of those regional partnerships have allowed us additional opportunities to advocate to the state requesting local control. So we do that several times daily, as you know. Just a brief reminder of the previous health officer orders, which were written earlier in April and late March. Since we last spoke 2 weeks ago, the newest local health officer order was effective on the 30th, which is this past week, essentially aligning the local order with the state order as it was at that time. So the biggest difference for most people was that golf and water recreation are allowed, provided that physical distancing is maintained. So we had a lot of questions about testing. I will try to slow down a little bit. In general, testing continues at the discretion of medical providers who can order that test. There are PCR and antibody tests available. There's a lot of caveats about antibody tests, which we'll get into in a little bit. But as of May 4th, over 600 tests had been conducted in Tuolumne County and fully reported back through the state system. And as you know, 4 of those were positive for residents. So we get a lot of questions about when can everybody just get a test? And the answer is probably relatively soon. But the testing that is required for the control of this virus is not simply just testing everyone. It is not just giving them a PCR test or an antibody test. And there are lots of hiccups on different levels of both of those tests, which we'll try to cover. 4 PCR tests, which are the nasal swab tests, which will tell us if you are infectious at the time. The biggest hiccup has been the supply of nasal swabs, which is rapidly changing and improving, which is great. We're making large requests from the state for access to swabs, and the state has received very large supplies of swabs in the past couple of days. So as our access to swabs improves, we can then open up the different priority areas for who can get tested. For PCR testing, that has been our rate limiting step. And we'll get into PCR molecular nasal testing versus serology or antibody testing in a little bit here. And just in general, what people should understand, what the public should understand, is that surveillance is a function of public health that happens all the time and will continue to happen. And so there will continue to be testing. And right now, our testing indicates that we have a very low prevalence of disease in Tuolumne County. But that will probably change, and so how we test will probably change with that, and we will continue to test even after many people get over the illness. So just kind of some heads up about that. This is, because we're testing so much, gets out of date quickly. This was from yesterday morning, and just showing that in the U.S. overall, over 7 million tests had been done, and in California at that time, over 700,000 tests were done. The state goals at the end of April were to test at least 25,000 tests a day, and that gets into addressing having enough supplies to do that, i.e. swabs and media, but also making sure that all of the labs were functioning at their highest capacity. So you could have all the swabs in the world, but if you send 1,000 of them to a lab that can only do 100 of them, it's not doing a lot of good. But if you can know that there's a high capacity lab somewhere else that you can send those labs to, you can actually run that many tests a day. So their overall goals on the state level were to increase the number of tests, to have a fast turnaround, to have a high accuracy, and to have convenient and equitable access. I'm just going to switch forward and then go back. So overall, in the past month, from the end of March to the end of April, as a state, the testing capacity has drastically increased, mostly in getting the samples to labs that have the capacity to do them and to increase the access to swabs. So, local minimum goals, which we will need to demonstrate that we are at this level if we do an attestation, are 1 per 1,000 residents with a goal of 2 per 1,000 residents. We're already at that, and we have capacity beyond that, just locally. So that's the minimum, which is not to say that that, is what we fully expect, because as we test more and more people, we expect to far exceed that.
So Dr. Ortiz, just to clarify, we're already at stage 3 as far as testing.
No. Sorry, I could have been clearer there. That's stage 3 of the state's reopening. So we'll get into that in like 15 slides. Bear with me. So this is just another slide that demonstrates the state level of testing and how quickly that improved over the past month. In Tuolumne County, we are the gray line here, and this compares us to Mariposa, which is orange, and Madera, which is blue. So this is the Yosemite Gateway area coordination team's testing capacity, and we had already been testing nearly twice as much as our neighboring counties in terms of our population. So that gets into state testing sites. The goal for the state was to make testing available to people within a 30-minute drive in an urban area, within 60 minutes in a rural area. There are several sites that are now running in the Central Valley, and there's a site that is now running in Mariposa. So people in Tuolumne County are within that driving distance, but we also have capacity within Tuolumne County. And we have notified the state that we are interested in the next rollout of state testing sites. So, just because there's a lot of confusion about antibody testing, some of you have heard my quick and dirty, fastest antibody testing explanation. So for those of you who haven't, here you go. The blue line is the actual virus, so what we would call the antigen. The green line is the first antibody that shows up, that your body makes first when it's very first introduced to any infection. It's called an IgM. M as in Mary. And the red line is the IgG, which is the type of antibody that you make for long-term response. It takes longer to produce, but then you have it around for future exposures to whatever that infection is. So, and this basic explanation kind of applies to most infections and most things that cause antibody production. You get infected and you have that blue line slowly increasing even before your symptoms start. So you have an asymptomatic stage for usually a couple of days. And then your IgM, your green line on this graph, which is your first set of antibodies, can sometimes start to be detectable around 7 days, but that's quite variable. That's the one that increases first, but it doesn't stick around forever. The IgG, which is the one that does typically stick around for a longer period of time, doesn't start to show until 14 days, at which point you're usually recovering. So it's really important that people understand that antibody tests are not useful for diagnosis. If you are sick, an antibody test is not going to help us figure that out, which healthcare providers understand, which is why they would rather do a PCR test in a symptomatic person. Where an antibody test, if it were to be an accurate test, where that is useful is to see if you have been exposed and if your body has produced a response. For diseases that we have a lot of information about because we've known about them for a very long time, we know what those cutoffs are. Pretty much everyone who's been pregnant or has a family member who's been pregnant may have had this pregnant woman get a titer to see if they had a vaccine or had chickenpox before. So that is, for a disease that you know a lot about, can be very accurate. However, this is a brand new disease. There's brand new tests. A lot of them, the overwhelming majority of them, are not FDA approved. They are not accurate. There are a few that are FDA emergency use authorization approved, and that comes with a lot of caveats. The biggest of which is even if the test were good, even if it was 95% specific and 95% sensitive, there's still a lot of complications because if you don't have a lot of disease and you're doing a test that is not 100%, because nothing is 100%, you will get more false positives than true positives if you have a low prevalence of disease. which is what we have in Tuolumne County right now. So we don't recommend that people get this test as a blanket at this point, or as a blanket statement at this point. What we are telling people is to speak to their healthcare provider because they need to have that understanding of what is the appropriate test and when, and what are the caveats of potentially ordering a test that is not FDA approved, and what are the accuracy levels of the specific test. There are a lot of problems with this, and part of that includes a lot of this is not coming through on our usual state reporting system because it's so new and the overwhelming majority of them are not FDA approved. So what we are recommending the public is if they are interested in an antibody test to speak to their own physician. So it's not just testing specifically for the disease, and that's partially because we don't have the greatest test and the unlimited quantity of tests. We've had to kind of come up with some workarounds. One of those workarounds is febrile respiratory illness screening and the order for healthcare providers to report febrile respiratory illness. So this was put in place in March, asking that all healthcare providers report all patients who have a febrile respiratory illness. Because we knew that we were telling them all to stay home. So they weren't coming in to get tests. So we are continuing to monitor the reporting about patients with febrile respiratory illness. And then febrile respiratory illness screening is what essential employers have been instructed to do for their employees so that they can identify when people are ill and need to go home. So that's part of our overall attempt to address the difficulties in testing. And then the very basic thing that we always do is what we call syndromic surveillance. So in another scenario, for example, we would want to know if the hospital was seeing a large number of people vomiting so that we could then look for, okay, was there some sort of foodborne illness outbreak going on? So we always do this. We do this for things that are not COVID. We do this as a baseline so that we can have that baseline that we can compare. So if all of a sudden we saw that we did see an increase in respiratory illness, even before we saw people being hospitalized or getting lab results, syndromic surveillance is our early warning system. So. All right, shifting gears, surge planning. This goes to Christina, so tag, you're it.
Talking faster than I do. So public health continues to coordinate with our hospital, ambulance, EMS, and other healthcare partners to plan and prepare for a potential medical surge. We continue to work with those healthcare partners as well as our Yosemite Gateway coordination team to conduct the epidemiological surveillance that Dr. Ortiz was just talking about with regards to tracking a potential surge. The hospital has done a great job in increasing their surge capacity to respond to a surge, and we have plans underway to set up an alternate care site if that is needed. Next slide. Through our Medical Health Operational Area Coordination Program, our MOOC program, we continue to process resource requests as they're received and to supply them to local healthcare, law enforcement, safety, and community partners. As you can see in the slide, between March 11th and May 3rd, we have processed and provided locally over 100,000 PPE. At this time, we're focusing a lot on our congregate living facilities to ensure that they have the 14-day supply of PPE that they need to meet the criteria for any lift of the stay-at-home order.
So some of you guys have become familiar with the term flatten the curve, which refers to the idea of shifting the area under this curve over a longer period of time so that we do not hit or exceed the surge capacity. So this was some of the initial surge modeling. As you can see, the white horizontal line relatively low there at about 50,000 was part of the reason that we so urgently needed to address our surge capacity and to put in significant mitigation efforts to reduce the level of transmission of this disease. So initial models that demonstrated the impact of physical distancing in California varied greatly. So you can see that large bright blue area, and then you can see a light blue line closer to the bottom there. Hopefully you can see that on this projection or in your slides. And then on the orange diamonds across the bottom were the actual numbers. So this is something that we, as a state, have continued to monitor and to notice that we are exceeding our modeled impact, which is a good thing. So we've been able to change some of our surge planning to be a little bit more realistic based on what the actual hospitalization numbers ended up being. So the number of people hospitalized and the number of people in the ICU that we expect at the peak has significantly decreased, which means that we hope that we are able to avoid a full surge, and we hope that we will never have to open an alternative care site, and that we can just support the hospital in maintaining this. So one of the things you'll notice here is I put the mean and the median because the median is significantly lower than the mean. But we still have plans to reach the third quartile of the models. So that has significantly improved since mitigation efforts have been put in place. But I do want to point out that these models don't take into account some of the unique aspects of Tuolumne County, which make us a little bit more vulnerable than some of our neighboring counties. One of that is the average age of people in Tuolumne County. We know we have a high number of people who are considered vulnerable simply by their age. As you know, before I've presented to the board about the incredibly high rate of chronic disease in this county. At the time that I presented, we were the #1 rate of chronic disease in the as a county in the state, even accounting and even adjusting for age. We have a high rate of respiratory disease, largely due to our high rate of smoking, which of course when we're talking about a respiratory disease is hugely significant. And we have a relatively small healthcare system. We have one hospital, as you all know. So, Tag.
So planning for local recovery. We understand that the situation is rapidly evolving and that things change very quickly, and sometimes changes in orders vary between jurisdictions. So public health staff monitor these updates, and we're advocating for local flexibility when developing local guidance to modify the stay-at-home order. We advocate at multiple levels. We advocate as a region through our consortiums. We advocate as an area through our area coordination team, and we advocate as an individual county. Through various state work groups such as the California Health Executives Association of California, or CHEAC, the California Conference of Local Health Officers, CCLHO, as well as numerous CDPH calls, we are advocating to the state regarding our local plans and readiness to loosen our stay-at-home orders as appropriate for our individual county. Next slide. So the state has recently provided updates on their plans to modify the stay-at-home order. The first major update was on April 14th, where the governor and the state health officer outlined 6 indicators that we need to meet while planning to reopen. Additional updates were provided on April 28th, which then outlined their stage-by-stage approach that they were intending to implement. And the most recent update was yesterday, May 4th, which announced a clearer timeline for reopening, with stage 2 occurring as early as Friday, May 8th. Next slide. So to clarify, the federal government has outlined their approach reopening in phases, and the state has outlined their reopening in stages, so to just make things very confusing. So what we were trying to do in this slide is to kind of outline those two side by side. So in the state of California, we're in stage 1. There is no formal phase 0 for the federal outline, but we tried to put these side by side. As you can see, as you advance through each phase or stage, conditions allow for loosening of that stay-at-home order. It allows for more high-risk businesses to open, larger gatherings, until finally we reach that final stage where things are operationally normal or we end the stay-at-home order. A key thing to each stage is to know that those up and down arrows, that we're able to move up and down those stages as we see, as we track the disease. And more importantly, to move from each stage, there are certain criteria that need to be met, such as adequate testing and contact tracing capability, which Dr. Ortiz talked about, adequate healthcare capacity, which we've been doing with our surge plans, and plans to protect our vulnerable populations and promote social distancing. So just keeping in mind that we need to be able to move back and forth between that. And once we see a large rise in cases or our ability to mitigate the spread of disease is greatly affected, we have to be able to move back and forth, as the governor said, dimming that light switch. Details of each phase are in that link. So slide 35, we've been monitoring these updates on all levels, federal, state, local, and regional. For the past few weeks, staff has been convening with various sectors. We've been looking at all the federal and state plans. We've been looking at what regionally is happening around us and trying to process all of that information. In the recent weeks, we've worked with Supervisor Campbell to meet with community agencies who work with vulnerable populations, such as the elderly and homeless. We've met with school representatives and child care providers as well. We've worked with Supervisor Rotifer, the EOC, and Cole with Business Innovation to convene our community business owners to get their input on development on this guidance. As you can see through that slide, there's a lot of moving parts, and we've been operating with no clear time frame. But we've been doing our best to make sure that we get as much community input from community members, community agencies, as well as those business owners in development of these draft guidances. As of last week, the guidance plans were underway. However, with the announcement yesterday, we are working waiting for further clarification from the state on how to move into stage 2, meeting certain attestation criteria, which Dr. Ortiz will discuss.
So, for those of you who are aware of what happened at the press conference at noon from the governor yesterday, they plan on doing what they're calling a soft opening into stage 2. Stage 2 for them are lower risk businesses or occupations, those that don't require a lot of close physical contact with another person. So they're less risky to open. And they announced yesterday that as a state, we would move into the soft stage 2 with retail and curbside pickup, but that locals would be allowed to be more strict if they wanted. So places like the Bay Area and Los Angeles that are currently seeing more transmission may not want to allow that business reopening. And they also announced yesterday that local health jurisdictions may attest that they want to accelerate through stage 2 faster. We can accelerate through stage 2 up to stage 3, but not past stage 3. The state has told us that we can expect a full and detailed list of what falls into each stage. We continue to advocate for local control even beyond that. But as far as we can tell so far, and on my call in 2 minutes, the local jurisdiction will be allowed to have the health officer attest that they have a certain level of readiness and a containment plan. They gave us a few notes on that yesterday. They did not give it all to us in writing with details just yet. But this is what we know so far. So the local health officer would need to attest to the county's readiness for minimum testing capacity, the ability to conduct contact tracing, support vulnerable populations who may need to be isolated, such as Project Room Key and offering temporary hotel housing for people who are homeless or underhoused. The ability to issue isolation and quarantine orders within 24 hours, the ability to handle a 25% hospital surge, and readiness for congregate living facilities. They also are expecting that local health officers publish a containment plan with details on how they plan to increase testing, increase contact tracing, increased surge, and their relationships with surrounding counties and how we will address travel, which we all know is how we will increase our disease transmission. So more details to come about that very soon. And there's still some discussion about what action the board may need to take for that. Hopefully we will hear more in the coming hours.
So our PIO and communication section continues to maintain situational awareness. As you all know, the situation changes rapidly, sometimes by the hour. So through our call center, our social media, and our daily updates, our communications team has done a tremendous job in coordinating messaging and being able to respond to public inquiry as information is made available to us. We've gotten into a steady operational rhythm with our joint information system, and we have an increasing amount of interagency messaging going on between all of our partners so that we all are on the same page. Next slide. Oh, next. Sorry. So just as a reminder, there's now a COVID-19 community portal. Staff from the CAO's office, the County GIS Department, and Public Health have worked hard to process all of the various web pages and links related to COVID-19 in a central location. The website is intended to serve as a portal where different agencies' information can be housed so that when a community member goes onto this website, they're able to find what they are looking for. So the portal will take them to the various link that they need to go to. As the situation evolves, so too will this website. All the different services change almost every few weeks, and so this is a living kind of website, and it's a continuous work in progress, but for now it is live and available for our community members to use. We will continue to update the page and incorporate any feedback we get to make this tool more usable and helpful for the community. The link can be found there on the slide. And as usual, community members can get general COVID information from our public health lines, the Adventist Health Line, as well as, next slide, the various web pages. As always, our information is on our website and our Facebook page, as well as our daily update. And now it will be also linked to that COVID-19 portal. So, yeah.
That's it? Happy to take questions.
Thank you. No, that was a quick run through, and I'm going to look forward to, I think Supervisor Campbell's going to be hosting a forum, much like Supervisor Rotifer has, so the public can really dive into some of the information and be able to ask you questions. And I think that's going to be very helpful in understanding this. But I'll ask now, start.
Yeah, one of the questions that we've got since we've opened up the golf courses is the inability for people to ride in carts even as a single individual. Some of the people have pointed out that there's a number of golf courses in the state that allow carts, but only one person in a cart or one person, another family member. Is there any look towards possibly changing that requirement a little bit to where we can let people use the cart? What I'm worried about is we have, like you said earlier, a lot of older people, and I hate to see people trying to actually walk 9 holes in golf and then die on the golf course. So just something that I think we need to really look at.
Yep.
Okay.
So the health officer order that was put in place on the 30th, this past Thursday, aligned with the written specific guidance from the state. It seems like we will be getting some flexibility this Thursday or Friday.
All right.
So.
Thank you.
Yep.
Supervisor?
Yeah, just a public information announcement. We will be talking more on Wednesday evening about, as we get to know more, we'll have more to offer Wednesday evening at 6 o'clock on the Business Assistance and Innovation sponsored webinar with businesses on some more details, to the extent that we know them, about how we might be pursuing opening up businesses in the near future. So if you're a business owner, we invite you to listen in. You do need to register for that, just simply for internet security purposes. But feel free to go on Cole's website and register up, and we'll talk to you on Wednesday.
Yeah, I just wanted to thank you guys for the presentation. There are a couple of slides that you brought up there that I think really highlight the work that's being done through public health and through our social services office to keep our community safe. And just looking at, like slide number 5, where, Tuolumne County is by far lower incidence of infection than all of our neighboring counties, except for Alpine County, which is much more remote and much smaller population. So we are well ahead of our neighbors in terms of the response here in Tuolumne County. And then the other slide is our testing rate is well above other similar-sized counties and other neighboring counties. And our availability of public health resources is higher. It's just going down the list. Every metric you can look at for our response to this, I think, has exceeded other counties and my expectations. It's been very difficult for a lot of people having the closures, but I am convinced that we have saved lives. And we will never know, of course, how many or who could have been affected, but we have, no matter what happens tomorrow with infection rates, we have pushed that curve out far enough to where we have the space and the resources to make a really solid effort at combating the illness should it become a larger problem in the county. And of course, we want to prevent that as long as we possibly can, but I think we did a great job up to this point. And I just really wanted to thank you and then your predecessor, Dr. Sojenko, for the work that you've put into coming up with this plan. And all the people that are working in public health and social services, I can't imagine what kind of hours you guys are putting in. It's just I've talked to each of you at least, pretty much every one of you at least every single day, and you're always on the phone and always going into meetings, and your staff is doing the same. So thank you for that. I just wanted to highlight a couple things you brought up. Thank you very much, Supervisor Brennan, for mentioning our community resources and schooling workshop that's going to be on 4 o'clock on Friday. And I also wanted to highlight Project Room Key. The contact for that, if you or someone you know is at risk of homelessness as a result of this, you can call 533-7401. And that's the number for Project Room Key. Thank you.
Take this off so I don't muffled. I know you have to go, but I have a few important questions, so thank you. First of all, have there been any increases in respiratory illness since December? Looking at the slide. No, in Tuolumne County.
Yes. Yeah, it is, still cold and flu season, and we
But other than the regular, okay.
It has been a severe flu season, so there has been an increase in respiratory illness overall. Yes.
2 years past?
Yes.
Okay. And then one thing, when I step back and I look at testing, I think, what are we at? We're at 700,000 tests, which when I do the math in California, that's only 1.8%. So if a lot of our planning, surge planning, how we're going to bring things back to recovery is based off testing, I feel like we're going to be here for years waiting for testing.
We're at 30,000 a day at least.
So 30,000 a day,
drastically
how long will it
increasing.
take to get 39 million? Do we have it 6 months?
It's not every single person needs to be tested one time.
My point being is we don't have enough time to test everybody, in my opinion. And
that's not the plan.
Right.
Yeah.
And if you get tested today, it's irrelevant because tomorrow you could be exposed.
Which is why that's not the plan.
Right.
Right.
So we agree that testing is something we need, but it's not going to be a fix-all. So when people call me and they say we need more tests, we need Tuolumne County to do all the tests, testing's not the benchmark for how we're going to move forward, correct?
Not quite. So we need to be able to test all the people who are symptomatic at least. Because if somebody is symptomatic, you want to be able to isolate them accurately. What we've had to do, because we have not had the testing capacity to do that in the past, is do this massive stay-at-home order. So and also 30,000 tests a day is not the final goal. It's where we're at today.
Right. I'm sure it will increase
it continues to increase. So what you do is you prioritize, when you're limited in supplies or limited in tests, you prioritize who needs to get tested. And as your supply and capacity increases, you open that up. So we're quite close to being, assuming we get the swabs in the next couple of days here, we're quite close to going through all symptomatic people. And then beyond that, we would start going into asymptomatic people as surveillance, which again is not everyone just once. So there are ways to do that both with swabs and with antibody testing over the long term. So we need to be able to test the people who are symptomatic and who are contacts so that we can just isolate those specific people. You kind of wrap around groups that are ill. So long as you're able to wrap around groups that are ill and can demonstrate that your healthcare facilities are able to handle the load that they have, then that's when you get to modify these orders.
Is that basically slides 37 where we're at? We are able to.
So we are able to meet. We are exceeding the minimum expectations for what we would need to be able to do to a test to open into stage 3. Yep.
Right. Okay. So let me see if there's any. So and that kind of brings me back to my point, and I want to sidetrack just for a second because it has to do with the conversation. But was the 9:30 appointment pulled for rotifers? It was, correct?
Yes.
9:30?
I will be pulling.
It will be pulling it? Okay. So, and the reason why I bring that up is because, if I go and I look at slide 28, this is a testament to how awesome we're doing. Mm-hmm. Absolutely. California, Tuolumne County, we're kicking butt when it comes to these graphs. And I feel like the discussion needs to come, I feel like the goalposts keep moving with Newsom. As this is daily, weekly, goalposts keep moving. First it's months, then it's weeks, then it's days, but we're not sure in phases. And when I look at this number and I look at hospitalizations in California and specifically in Tuolumne County, I guess we're pulling the 9:30 appointment, but I feel like, LA is as far away as Arizona. And we have businesses, we have people whose livelihoods are being destroyed. And believe me, I think it was 5 or 6 weeks ago, I brought a resolution to put educational checkpoints to screen people from coming into our community. Not pushing them away, but just simply educating them before they come in. And that was based off a surge plan basically designed by the WHO, which said that we had, we're going to probably have about 5,000 people infected, about 500 people in the hospital ICU, and probably about 150 dead. And those numbers were based to come around first, second week in May. So now here I am, I'm reevaluating the information. We're all trying to make the best decisions moving forward. And I look at the information at hand, and I think what a lot of us didn't take into account was the resilience of Tuolumne County, of Californians, which is, we saw this pandemic coming. We got our acting gear. We did social distancing. We did proper hygiene. We stayed home. People gave up a lot of livelihood for it. But now I'm looking at the new information, and it's like we have to observe this. And I know there's still numbers going up throughout counties in California. But I would like to, I know we sent a letter to Newsom on Friday, was it Thursday or Friday, about localism and about having more flexibility, and we gave him a May 8th date. And I know on May 8th he's going to have a briefing. But I don't think we can push this can down the road anymore. I feel from local constituents in my district that people are going to start doing things whether we agree with them or not, and I'd rather be on the side of looking at the information, rolling out plans, actions that we can get behind our businesses and support them. And I know you guys are working on this. I have to say this publicly because
it's fine. I just think I can say something to reassure you quite a bit, so it's fine. Go on.
But we need to get there ASAP because part of the Declaration of Independence says that we have life, liberty, we have these things, but it's all by the consent of the governed. And so we're losing the consent of the people that are following the line trying to support this moving forward. And so I'd love to hear what you have to say publicly about that moving forward. And it's not to undermine you guys it's based on this, right? We want to make decisions based on the information at hand. And so I feel like we very quickly, I would almost like to pull an emergency meeting for Thursday the 8th, or maybe we could hit at it next Tuesday, but
So Supervisor.
we're at stage 3 the way I see it.
Supervisor.
I'm trying to get you there.
So.
Yeah.
Thank you. So let's talk
the
about
call
that.
right now is about getting us to get to stage
Correct.
3 potentially on Friday.
And so we want to get you to your call. That's really important.
Then
and
go to your call, please, because
two pieces that are very important that the entire board may not be aware of is, number one, track and trace is a huge part of this. And Mariposa County and the system that was put in place shows that success. And
Which we have here.
Which we have been, and I want to highlight that to the public. Thank you, Sheriff. Thank you, deputies. That is a huge part of the piece of this, and it's the ability to utilize the resources that we have that know how to do that work. Thank you, Dr. Serjenko. You guys implemented that early, and Mariposa is part of that success story, and it's going to be part of our rollout here. And then the other piece is, and I know you're going to get at this, Liza, is we're not looking at just stage 2 or stage 3, but a hybrid that's stage 2.5, because we have partners. Yosemite National Park does not want us to just go automatically to stage 3 and say we're going to welcome visitors from all over the world again, which lifts the travel order. So again, I know you're working diligently. Rebecca, you hit on this with a couple of us because of the Brown Act. I think every supervisor wants to be involved in this, but please, whatever closing comments you have,
Sure.
We want to get you on your call.
Yeah, so public health, as do you guys, I know, advocate several times daily to the state through many different avenues, asking for that local control, because we know that we don't have community transmission right now. I literally just got a text about the swabs being delivered. We know that in many ways we're ahead of the curve in our readiness, and that all that credit goes to the public health staff who is staying up all hours writing all sorts of plans that then I walk in and go, just kidding, we're changing the plans. We have testing and tracing capacity. We have been testing people. We have low prevalence of disease. We have been working with the hospital for surge capacity planning. We have relationships with our surrounding counties. We're in as good of a position as we could possibly be to be able to attest as soon as possible that we can accelerate through the stages faster. And we're finally being given some of that local discretion as soon as, in the next day or two. We will give more information when we have whatever we have by tomorrow. We'll be giving that information to the businesses on the webinar. We know that the state is going to be putting out dozens of sector guidances for how those different sectors can reopen safely. And so a lot of information is going to be coming in this week. What we have been in discussions about with our Yosemite Gateway partners is we know we're in a great position with what we're at now, and we know we can absorb quite a lot of what will change as people leave their houses. That is assuming that we don't get an onslaught of travelers from all over the world. So working with the Department of Recreation and the National Forests and the National Parks and all of our partners to try to figure out how to best reopen some of those things that would be most attractive so that we are able to absorb that capacity. But we are in a great position with our testing capacity and our contact tracing and isolation capacity. And I expect that we will be able to attest as soon as possible.
So I think there could be a few questions for other staff. I want to thank you and get you on your way to your call. And remind the public, Ryan, can you please, again, give the information on the webinar that you will be doing on Friday? I think it will be really, you're going to have a lot of folks very interested in listening and participating.
Yeah, so we'll be discussing primarily schooling, childcare, and then resources for vulnerable populations. I'll be at 4 o'clock, and we'll be releasing the sign up probably by the end of the day for folks that are interested in signing up on that. But there'll be a link to it on the county website.
Great. Any other questions for Dr. Ortiz? I'm going to do public comment, and then I do have a question or two for Jason, but I won't. No public comment? All right, thank you, Doctor.
Thank you.
Thank you.
I want to thank the entire public health staff. You folks are awesome. You've been working hard. I don't think the public has any clue how hard you've been working unless they happen to be married to you or otherwise live with you. It is incredible, and we are where we are because of you. So thank you very much.
Absolutely. I took a pause when I said thank you, Ortiz. I've got to learn not to do that. I could not agree with Supervisor Rotifer's words more. Again, please extend our deepest and sincerest thanks to the entire staff. Right. Yes. I have had a couple of emails and questions from some folks about the restaurant program, and forgive me, I'm forgetting the title of it, but if you could comment on that's where folks can go and get food, and there's a reimbursement rate. Can you provide some information, because I know there were some tight timelines and
Absolutely. It was it changed names a couple times, but it was known as Restaurants Deliver or Great Eats. This program was pushed out by FEMA and through Cal OES. The original intention, it was a two-pronged approach. The first prong, of course, providing meals to our vulnerable populations, and the second prong to allow some restaurants to get additional business and kind of hit two issues at the same time. We looked at this program very closely because on the surface it sounds like a great program. The hurdles that we run into with this program is FEMA provided very clear criteria that needed to be met for any person that wanted to be on this program. Of course, they had to be a senior, so 65 or older. They could not be a part of any federal programs such as WIC, CalFresh, EBT. There was a small list there because that would have been considered a duplication of benefits. Also, anybody that was on the program needed to be vetted that they did not have the ability to go and get groceries or to go get meals, and they couldn't be a part of any current Meals on Wheels or other senior program. So as we looked at all of that guidance and spoke with several of our partners within Agency on Aging, Area 12, along with our social services, and trying to find folks that would meet that criteria, it was just too restrictive of a program to move forward. Cal OES gave us a 72-hour deadline last week to try and find folks that are eligible for that program, and with the restrictions, we just ran into a wall with it. We did talk to several restaurants as well. The restaurant community was very excited to be a part of that program, but of course, as we spoke with them, we also let them know of some of those restrictions that we were facing.
Thank you. Any other questions on this item? And there still is no public comment? All right. This was.
I just had a really quick question. Have you communicated with any of our partners? Are they facing kind of a similar roadblock to using this? It's just kind of baffling to me that this program was made available, and yet we're not allowed to use it in the way that would most benefit our community. It's just really frustrating. We see this kind of time and time again where money is put out there under the guise of helping, but there's nothing to back it up. So thank you very much for doing your best and looking into it. It's just very frustrating.
And in response to your first question there, we did speak with our state representative, who also informed us a lot of rural counties are having a very hard time fitting the people into that criteria.
Yeah. Is it just rural counties? It seems like even urban counties would have a problem finding people in that sliver of the population that might potentially benefit.
The message was rural, but I imagine any jurisdiction would have a very difficult time fitting that small.
Thank you. No more questions. It's just very frustrating.
All right, thank you. And again, I know you had up the calls Monday, Wednesday, Friday, with a lot of participation from all of the agencies and different jurisdictions that are participating. Please extend our board's thanks for, again, all of the continued, it's that collaboration to a large degree that I think is helping us achieve the kind of numbers that we heard about this morning.
Absolutely.
And Madam Chair,
Yes.
I am going to pull the second item on the 9:30. I had drafted a resolution for the board to consider to bolster and reemphasize the points in your letter to the governor for localism in the event that his response was a little slow in coming, but given his press release yesterday, or press conference yesterday, and the promise of a further guidance by Thursday, I don't think that resolution is necessary, so I'm going to ask that it be pulled.
All right, thank you. At this time, let's take a 10-minute recess. Oh, okay, I'm sorry, there is one public comment? Oh, thank you.
Good morning. Madam Chair, members of the board, this is Corey Allen with the Health and Human Services Agency. And in regards to the Great Plates Delivered program just spoken of by your CIO representative, I just wanted to let you know that his outreach with the Health and Human Services Agency has given us opportunity to outreach to each individual that has called. And to each individual, we are screening for eligibility for other programs that we may provide. We're making a warm phone call, and we'll continue to do that with anyone from our population who calls in relation to the Great Plates Delivered program.
All right, thank you for that very important information. All right, is there any other public comment? Okay, seeing none, we will recess for 10 minutes.
So I got to tell you this story.
So this is consideration of approving the budget adjustments for the fiscal year 2019-2020. And if you'd like to call in for public comment, the number is 533-6581. And there's a slight delay, so call in now, please.
Good morning, members of the board. Madam Chair, Eric Earhart, County Administrator's Office. About a week and a half ago at the April 23rd board meeting, your board approved some budgetary adjustments to the 2019 and 2020 adopted budget. However, at that time, we did indicate we would be back with additional changes as we work towards the end of the year. The changes before you today actually take into account some of the impacts of COVID-19 health emergency. Our focus over the last week and a half was primarily on general fund departments, not necessarily general revenues. We are still working on those numbers. And that includes things such as sales tax, the TOT, property tax, and other state and local federal revenues. So since the 23rd, we've been working in conjunction with our county auditor's office to estimate year-end departmental expenses and revenues. Again, we are still looking at those general revenues as more information comes in. So the changes that we are proposing today are outlined in attachment A of this memo. It is estimated that departmental revenues will decrease by approximately $550,000 for the 2019-2020 fiscal year. Fortunately, our community development department has done a lot of great work this year. With the code change that came in, a lot of people rushed to get their plans in, so that drove up their revenues. So the revenues we're seeing in their department far exceed what was anticipated originally, and it's helping to offset some of the decreases that we have. Most of the reductions in the revenues are a direct result of the COVID-19 health emergency. These reductions are caused by eliminations or reductions of services throughout the departments. These are internal and external services, so services we provide from one fund to the next, or services we provide to the community that we are no longer able to provide at this time. Also, the revenue that we receive under Proposition 172 was reduced, and this is based on sales tax collected. And again, this is a result of the COVID-19 health emergency. While we do have a reduction in departmental revenues, we also have an equal savings in expenditures of approximately $550,000. Most of the savings comes from salaries and benefits caused by vacancies throughout the general fund. This also includes the savings created by temporarily closing the library, recreation department, standard park, and youth centers because of the COVID-19 health emergency. With the exception of the anticipated loss in the general revenues, staff has been able to balance the general fund departments amongst themselves. And so at this time, we are not asking for any money from contingencies or reserves. However, we are estimating that we will be back later in the month to ask your board to decrease the contingencies and reserves to match the loss in the general revenues. We're still working towards that number. Attached to this memo is a line item detail of the requested changes to the general fund. There are significant reductions in library, county recreation, youth center, and standard park budgets that are a result of the temporary closure. Based on the information we have today, it is not anticipated that the programs provided by the rec department, youth center, or standard park will be permissible under the state public health order that we have today by the end of the fiscal year. However, we did leave sufficient funding in the library budget in the event that changes occur in the state health order, allowing the county to open the library in a modified capacity before the end of the fiscal year. Also, with those changes in those departments, we are anticipating an increase in unemployment because of the furloughs that have taken place. And so attached to this memo is also a request to increase the unemployment fund. We are anticipating about 65,000, almost 66,000 unemployment claims for the library staff, recreation, standard park, and youth centers. We're also asking to increase revenue of 75,000 from the beginning fund balance. This also includes anticipated revenue from the federal government for the federal COVID-19 leave, where they're giving an additional $600 for the unemployment. So that's included in this as well. So with that, it is respectfully recommended that your board approve the fiscal year 2019-2020 budget adjustments to the general fund and unemployment fund that are detailed in attachment A. And with that, I would submit to your board for questions.
Any questions?
I just had one, I guess I'll make you restate one thing. So we do have enough money in the budget should the state health order be lifted prior to the end of the fiscal year to bring back some of those services like library, should the health order be lifted?
Yeah, so if there's a change in the health order where we can open the library in a limited capacity, there are funds left in the library budget.
Okay, but not the parks?
Correct.
Okay.
I was just reminded there is one line item here, or sorry, one department here that we will have to take separately. So if, at this time, I will ask if anybody wants to recuse themselves, and I will go over that so we can take that separately. It's the Public Defender's Office.
Okay. Well, in that case,
I'm going to ask for clarification because we need fourth
could we
vote, and so should we continue minus the one item and then do that one item separately? Okay.
Okay.
All right. Supervisor Kirk?
Yeah, under Regional Juvenile Center, I noticed in there's overtime salaries of $45,000. I don't know if you would like to touch on it or if Tracy would like to, Mr. Riggs. But can we explain what that is and maybe what we've done to curtail that moving forward?
So prior to the COVID-19 health emergency for several weeks, our population in the juvenile detention facility was, I think we were up around 20, which is significantly higher than what they're traditionally staffed for. So that's what drove those numbers up. We'd already taken action to start reducing those numbers prior to COVID-19. So we are anticipating that overtime to decrease because I think we're down, last I heard, we're about 11 in the daily population, so we're not anticipating that significant increase again. However, this is to cover the expenses that are already incurred.
For staffing ratios, once you reach that 15, you got to hire additional staff.
Correct.
Okay.
16, sorry. Thank you.
16, thank you.
Any other board questions? All right, is there any public comment? No public comment? Okay. And I am going to look to county council to be listening to the motion as it is made to make sure that we are correctly stating.
Madam Chair, I move to accept the amended budget absent the discussion reference to the Public Defender's Office.
Second.
I have a motion from Supervisor Rotifer, a second from Supervisor Gray, and I see county council shaking their head yes. All those in favor?
Aye.
Any opposed? Motion carries 5-0. Now, Supervisor.
On this next portion of the budget discussion, I'll be recusing myself. I am married to the Deputy Public Defender.
All right.
Good.
Okay.
Okay. In reference to, this will be actually in reference to the Public Defender's Office as well as the Public Defender Conflict Division within that office. We are asking for a net, excuse me, it'll be a net increase of $13,460 to their revenue with a increase of $3,500 to their expense. Most of this increase is due to some salary adjustments that have been made throughout the year to account for the new public defender, which all relates back to the salaries and benefits. And in regards to the Public Defender Conflict Division, we are asking for an increase of about $34,000 in expenditures to cover the cost of our third level conflict. This is actually a reduction from what was originally anticipated because with the court closures and postponing some of those cases now, we were able to reduce that cost for this fiscal year, but we are anticipating that next fiscal year. Any questions?
Any questions? All right, I'd ask if there is any public comment regarding the budget for the Public Defender's Office. There is no public comment. All right, bring it back.
I'll move on staff recommendations.
Second.
Motion from Supervisor Rotifer, a second from Supervisor Gray. All those in favor? Aye. Aye. Motion carries 4-0 with Supervisor Campbell recusing himself. All right. Thank you.
I'm going to sit here on my thumbs. Just want to get moving. Let's go.
Will the clerk please read item 16?
Consideration of approving an amendment number 2 to the CTS agreement for special testing services at the jail project. And also, if you'd like to call in for comments, the number is 533-6581.
Ms. Frank.
Good morning, Board. I'm here before you today in regards to a contract amendment for CTS. It's Construction Testing Services for the Jail Project. In January 2018, as you know, our county received SB 1022 and AB 900 funding for the construction of the jail project. Right after that, we entered into a contract with CTS for a third-party testing contract in the amount of $241,174. Then September 17th, 2019, additional testing services for the jail project was required, and amendment number 1 was approved by your board for a total of $132,959.57. Since amendment number 1, there has been several additional requests from CTS for their services and time out on the project. Basically, the services and requests can be broken down into 4 various different categories. One of those is for additional field testing services that were required due to inclement weather. Number 2 was additional inspections due to contractors, subcontractors, means and methods of doing the contracting work. The third one is additional re-inspections due to the contractor or subcontractors not ready for the inspections. And then we've already called out CTS for the job, and so either they had to stay and wait for it to be done, or they were called back for an additional day. The fourth category is administrative costs due to extended schedule and weather delays. The total charge of this additional work that's before you in this amendment is $227,053.86. Of this amount, $191,780.04 is directly related to Harris and their subcontractors. County staff has been in conversation with Harris throughout this past year. They are well aware of this, and their reply to the county is, send us the bill. So county staff is working on, now that we got everything straightened out in the final billings from CTS, we're working on a bill to send sending Harris Construction a bill for that, for the $191,000 for their portion of this bill. The CTS amendment number 2 for consideration before you today is the total amount of the amendment, as I said, is $227,053. The county's portion of that, as I said, will be billing Harris for the majority of that, but our portion of that is $35,274. This will be paid out of the construction line item that we have for the jail project. If this amendment is approved, a total of $1,575,416, or 80% of the construction contingency, would have been spent. This would mean that a total of $383,434 remains in the construction contingency line item. Currently, this project's at 90% complete. At this time, I just would like to publicly thank CTS. Even though they have been gracious enough to continue working out on the site as we continue to work with Harris and CTS in getting this building straight and figuring out what they continued coming out and responding to the job. And I just want to thank them for that. So before you today is amendment number 2 with CTS in the amount of $227,053.86. And I'm here to answer any questions you may have.
Any board questions?
Just for public interest, that money is coming out of contingencies. It's not general fund money, and we will be getting back $181,000.
$191,000, yes,
91,000.
Supervisor. That's correct.
Yeah, that was going to be my question too. So when we pay this bill and then are reimbursed, we're really only on the hook for about $36,000.
That's correct.
Okay, and then that 36 comes out of contingencies.
That's correct.
Okay, cool.
All right. Is there any public comment? There's no public comment.
Madam Chair, I'll move on staff recommendation to approve the amendment 2 to the CTS agreement.
Second.
I have a motion from Supervisor Rotifer, a second from Supervisor Gray. All those in favor?
Aye.
Aye.
Any opposed? Motion carries 5-0. Okay. Will the clerk please read item 17?
Consideration of approving a contract of sale of real property with Larry Griffith, Eileen Jones, Steve and Eileen Stevenson for the purchase of property in the Groveland area related to the construction of the Groveland Community Resiliency Center.
Ms. Frank.
This is an exciting day. This is a huge milestone in the National Disaster Resiliency Competition grant process. As you know, through that grant, the Tuolumne County was responsible for the construction of at least one community resource center in Tuolumne County. In 2017, we initiated work on these CRCs by hiring Lionakis architects. And with them and the community, we worked on a programming document. And it's from that programming document that we were able to assess what programs and services we wanted out of these facilities, how big the building needed to be, and what type of property then that we needed to look for as far as the size for that. A solicitation for property was sent out December 31st, 2017, with various criterias in regards to the location of the property, access to services, access to infrastructure, that the property had to be buildable, various things like that. For the Groveland CRC, the county received 3 proposals. These proposals were then reviewed and ranked based on that criteria I just mentioned to you. A complete property solicitation package was then prepared by county staff and was presented to your board in closed session. Staff was then directed by your board to continue to do diligent work on the top 2 sites. There was one in Groveland and one in Tuolumne, because at that time we didn't know whether or not we were going to proceed with 2 CRCs or 1. The top site in Groveland was a privately owned parcel, and again, I apologize. The 6 was dropped from the APN number that you see listed in your board memo. This property is part of a bigger parcel. We're only going to buy a portion of it, and it runs along Ferretti Road near Pine Mountain Lake. As was just mentioned, this property is owned by 3 people. The parcel is this parcel, along with the 2.6 acres being donated from Groveland Community Services District, which is your next item, will make up the Groveland CRC project site. The portion that we're considering to purchase is a little over 3.76 acres, and it met all the criteria that we were looking for in regards to a CRC. An environmental study was conducted on April 30th, 2019. Your board then approved the mitigated negative declaration for this property. Also, a preliminary title report was pulled and reviewed. There were no significant issues that were cited in that report regarding the property. Next, a formal appraisal of the property was conducted by Right Appraisals. The estimated value of the property was $390,000. According to the regulations that we have to follow, both Terry Cox and I, a preliminary acquisition notice was then sent out to each of the property owners regarding their intent to sell. Each of the 3 owners have signed and sent back this form. It was then followed by the formal sales agreement that's before you today for your consideration. The sales agreement, the county, in the sales agreement, the amount, as we've noted, that the offer will be made is $390,000, the appraised amount for this property. And in the agreement, the county will also be responsible for the closing cost and recording fees. Escrow has been opened at Yosemite Title, and the property will be closed as soon as possible. The National Disaster Resiliency Competition Fund will be utilized to pay for the purchase of this property. And I'm here to answer any questions you may have.
Any questions?
Just a comment, this has been a long time coming and a lot of hard work.
Thank you.
It
has been.
A lot of people. When you're ready, I'll be happy to make the motion.
And before I go to public comment, I just want to clarify, because I did get some emails on this, that the National Disaster Resiliency Compensation Fund is paying for this.
That's correct. All the costs associated with this project are paid for out of the, now there's 2. So there's the National Disaster Resiliency Competition, and because we had a gap in funding, the state was awesome in coming back to help us out with that, and we have a little over $5 million from the Neighborhood Stabilization Program. So both of those funds are going in to help to pay for the cost of these 2 buildings.
Thank you.
You're welcome.
At this time, I'd ask if there's any public comment. There's no public comment. So bring this back. Supervisor Gray?
Madam Chair, I move that we purchase a portion of ANP 066-090-032 along Ferretti Road in Groveland in the amount of $390,000 and authorize the chairman of the board to sign the sales agreement.
I'll second.
Motion from Supervisor Gray, a second from Supervisor Kirk. All those in favor?
Aye.
Any opposed? Motion carries 5-0. All right. Will the clerk please read item 18?
Consideration of accepting the land donation of 2.6 acres of a portion of a parcel from Groveland Community Services District and recognizing the land purchase in the amount of $12,000. And if you'd like to call in for public comment, the number is 533-6581.
Mo.
Okay. So as just mentioned, Board, this is a follow-up item to your previous one that you just heard. As you know, we were granted funds through the National Disaster Resiliency Competition to construct two community resiliency centers. When we did the property solicitation, we found what we thought was the perfect property along Ferretti Road. And as we started working with the architects on it and started looking at the programming document, we realized that we would really, to be beneficial and to really do the project right, we needed a little more acreage for that project. Because the goal of the Groveland Community Resiliency Center was really to create a facility that the community can come, learn, grow, and be together. And so for that CRC, we wanted to make sure we also had enough outdoor space as well as indoor space for the facility. So in that process of looking at, we needed more property. We also had some topographical variations in that property. So we have it from Ferretti Road. If you know, it drops down a good 20, 25 feet and then kind of levels out. As I said, it's Tuolumne County flat. To that end, we approached Groveland Community Service District staff to see if there were any opportunities to partner with them. They couldn't have been more gracious in that. They did not hesitate. They asked some really good questions, and they really saw the value of what this building and this center will mean to their community. On May 14th, 2018, Groveland Community Services District submitted a proposal to the county regarding their willingness to donate a portion of their property. It's two APNs, is a small portion of it, owned by the district. On April 30th, 2019, our board, you approved again, mitigated negative deck on this property. And also a preliminary title report was pulled and reviewed, and no significant issues were found on the property. A formal appraisal of the property was conducted by Right Appraisals. The estimated value is $12,000 for this parcel. A preliminary acquisition notice was sent out to GCSD regarding their intent to sell or to donate the property, and that's a requirement from HUD that form goes out. On April 14th, 2020, GCSD signed and sent back this form and reaffirmed their donation of this property, the 2.6 acres, to the county for the purposes of construction of this facility. The transfer of this property will be done by grant deed. I know in your memo it says a quick claim, but because of the astute awareness of my favorite county council who helped me on all of these board items, Chris is great helping us through this. The GCSD board had defined this donation as a grant deed, so we needed to change the legal nature of this. So you'll be considering and approving a grant deed, which will then be recorded by the clerk of the county. These funds, again, just like what we were talking about, it's a net zero. It's a donation, but it's contained within the NDRC budget. The board needs to just recognize the donation of this property at a value of $12,000 with a corresponding expense in the land. And so with that, I'm here to answer any questions regarding the donation from GCSD.
Just want to thank the Community Service District for stepping up, but really is going to make a great site with that additional property, even though most of it is part of a creek, but still, it's an important important piece. So when you're ready for a motion, I'd be happy to make it.
Is there any public comment?
Move on staff recommendation.
Second.
Motion from Supervisor Gray, a second from Supervisor Kirk. All those in favor? Aye. Any opposed? Motion carries 5-0.
Consideration of approving a Communities Resilience Center property use restrictions agreement containing covenant affecting real property related to the Community Development Block Grant National Disaster Resiliency Competition Community Resilience Center project.
All right. So continuing the theme here, on March 2nd, 2020, your board entered into Amendment Number 1 to the National Disaster Resiliency Competition. And this amendment was basically taking us out of Phase 1, which is the preliminary stage of our CRC project work, and moving into Phase 2, which is then the construction and then the operations of the facility. The amendment included the construction of 2 community resiliency centers, and it also referenced a use restriction agreement that would need to be signed at a later date. Before you for consideration is that use restriction agreement for both the Groveland and Tuolumne community resiliency centers. This use restriction is required by HUD on all federally funded public projects. The agreement states that the county will operate and maintain the CRCs for its intended use for a period of 5 years. And this is not new to Tuolumne County, this use agreement. We've had this use agreement on several other of our CDBG projects. For example, the Hope House, the Children's Shelter, and the dental clinic that we had. The use restriction agreement, as I said, is for 5 years and will expire September 30th, 2027. Other requirements of this use agreement are the HCD and HUD is expecting us to sign formal lease agreements with CRC service providers 90 days prior to the completion of the construction. And those use providers are the ones that are going to be renting from our facility. They're asking us to develop a comprehensive operational plan that includes the standards for maintaining the financial viability of each CRC, demonstrate the utilization of the CRC during emergency events, and submit annual reports for each CRC regarding the public services provided and other community activities and gatherings that are held in these facilities. If the county material breaches this agreement, HCD will notify the county of said breach, and we will have 30 days to then rectify any of those breaches or that situation that's causing that breach. HCD shall have the right to have the county reimburse some or all of the funds dispersed to the county if after 30 days the breach has not been fixed to their satisfaction. The amount of funds the county will need to return will be based on how long the CRCs have been in operation for the required purpose. So before you for your consideration is the use agreement for both CRCs for a term of 5 years.
Any questions?
Yes, I do. Take this off so I'm not muffled. It was important to me. I got a lot of emails, but fortunately I was already thinking along the same lines. And it was important to me. I shot Mo some emails, just some real basic questions. And so I'm going to go over those questions real quick, and I'm just going to ask Mo to answer them. You kind of touched on the payback, but I believe what you're referring to is if they were already built, correct?
That's correct.
Okay, so the 5 questions I emailed Mo, thank you.
You're welcome.
She emailed me this last night, was just to remind not only myself, but the community, with the budget, with everything going on, with layoffs, with the shortfalls, it was important to me that we don't keep adding to that debt and that we don't keep adding, basically make sure we get our house in order. And so I don't want to add add to that debt moving forward, or add strength to our community moving forward. So the 5 questions I had asked Mo is, can you give me an estimate of how much it will cost to run? Can you give me an estimate of how much we will get back from the renters in order to cover those costs? Do we have anything in writing with those renters, which it sounds like we're going to have to do 90 days prior? And then also, what was important to me was also, do we have an anticipated completion date? And if we stop the project today, would we have to pay any money back other than returning money back to the state? Would we have to go back and pay back any money? So if you could kind of go over those 5 questions, I'd really appreciate it.
Not a problem. Absolutely, I'd be happy to. So let's take it question by question. So the first question was estimate of how much it'll cost to run. So in the handout I gave you regarding building sustainability, and this is from right out of the report that I presented to your board just about a year ago, that I had to do as a requirement to HCD in proof that we've met all the requirements for phase 1 and we were ready to go to phase 2. So in the back of that package I handed out, it's the last page, gives you a budget overview. And basically the budget overview shows you, and the pages before that just gives you more detail. But for the purposes that right now, we can go over it in more detail, but just to give you an overview, there's 2 sources of rental revenue associated with these facilities. These are different facilities. It's not a community hall. This is a living, active buildings that we have designed and incorporated and will be so much part of the fabric of those communities. And so in that, what makes them, there's so many reasons why it makes them special and what makes them unique, but one of them is there will be offices that have been designed into these facilities that we will have staff from various agencies using and renting out those facilities. Of the office rental, the most right now that we have, so we did, working at the time with Larry Cope in regards to what the average rental space is, both in like the Groveland, Tuolumne areas, not downtown Sonora, but what was the rental rate in a more rural setting was 75 cents per square foot. So that's how we came up with it, times square foot of the office spaces that we have. We will have roughly $11,955 worth of office rental coming in every year from these facilities, just right off the bat. Then when you looked at event rental, that's the second source of revenue for these facilities. Now, what I did, and it's something that your board will have to, it's divergent from what your current rental rate is right now. What I did for the business assumption for these 2 facilities is looked at a rate of $10 per hour per zone. What's a zone? A zone is either there's a classroom, if you remember right, or that's one zone. The big room that can hold up to 200 people, that's actually 2 zones because it can be divided in half. There's an A and a B part of that big area. If you wanted to have the kitchen, that's another zone. In the Groveland area, if you wanted to rent out the amphitheater, that's another zone. In Tuolumne, if you wanted to rent out the parking area, that's a zone. So if you were coming to do an event, say, and you needed the big room, so 200 people, you're having a large event, you're renting out 2 zones, plus you need the kitchen, so that's 3 zones. So that's basically $30 an hour. So we did, as you see, we're estimating based on our current rental of our current county. Only thing I had to go by is the current rental we had for our community halls, and then extrapolated how many rentals we would have in a year. I came up with, just for the first year, the 28,200 for Groveland and 28,400 for Tuolumne. So if you couple those 2 rentals, you get a total of $40,155 or $40,355, depending on which center there is. Then what I did is I looked at the expenses, and again, the details are on the previous pages. I looked at what we're currently spending on the 3 community halls that we have right now. What is Egg Hogue and Facilities Management doing right now as far as that? And I increased it based on the size of these facilities. And our operating expenses and maintenance costs for each year is basically $30,554. So if we do that and you look at the proposal, if we're able to sustain that, that actually nets out $9,601 or $9,801 for us to be able to put away into an account to help pay for, in the future if we need to do something to the facility or we need to do something, replace an HVAC in a couple of years or what, hopefully it's many years, but, things like that. The second sheet I handed out is pro formos that I had to do for the state of California, again, showing and proving what we expect for those 5 years for each of those facilities. And what I did is I took out and I just spread across the expenses and the rent for 5 years and what we expect. And what you see on the pro forma is basically a slight increase in rental of the facilities over the couple of years. And so with that, if we do adopt some type of charges for these buildings for everybody that uses them, then yes, we'll be able to sustain the buildings at no cost to the general fund. So that was your first question. Do you want me to stop there and see if there's any questions about rental or cost? Okay, so then your second question was how much will we get back from renters to cover the cost?
You kind of already answered that question.
Right, so that's what I'm saying. I just answered it unless you want me to go in any more detail on that. 3, do we have anything in writing regarding those potential contracts or renters? And actually we do. Before we were able to move on from phase 1, HCD required that we had pretty strong partnership agreements from people that have committed to not only provide service but rent space from us in these facilities. So for the Groveland CRC, we have people that have committed to renting offices, renting space. So, for example, ACA is going to rent not only an office, but they're also going to rent one of the zones or 2 of the zones in each facility each week to do food distribution in each of those facilities. You have Columbia College, who we've been working with closely and is ready to do classes in both facilities. Health and Human Services, the Sheriff's Community Service Unit, and in Groveland, the Southside Seniors. So those are your paying, renting customers that have already committed on the dotted line right now. You also have intermittent partners, people that have committed to providing services or programs up at those facilities. For Groveland, you have Groveland Community Service District, Motherlode Job Training, Animal Control, Library, Tuolumne County Library and Adult Learning Program. In Tuolumne, I won't go over the list again, there's basically the same providers there. The only difference is the superintendent of schools will be renting out the classroom on a full-time basis there during the daytime to do some classwork up there. So we already have people that have signed kind of formal partnership agreements, and then as you noted on the use agreement, 90 days before we open, we will sign formal rental agreements with HSA and the community service unit. I'll have to talk to my attorney, but usually we don't have formal agreements between county departments. We will probably have an MOU, is my guess. And usually that's what we've done in the past. The anticipated completion date for these 2 centers is we need to be completed by the current grant deadline by June 30th, 2022. So that's the building completed and people moved in and ready to be operational. And as it looks right now, both Terry Cox and I are adhering to despite roadblocks that keep being thrown at us, we are pretty much on time and on schedule. We have finished with the architect's office on design development, and we are working on plans and specs as we speak. Those plans and specs will be done by October of this year. They will be out for review for different agencies for 3 months, and we'll be out to bid then for this project in January, which then will be back to your board to award in March, with construction starting basically a year from now. As we are. We have put into the schedule a 14-month construction window. These buildings are only 8,000 square feet. It is not detention. Makes them much simpler. So we have no worries about being able to complete them within 14 months. So that's kind of where we are. Your last question. If we stop the project today, would we have to pay back funds or to the state? That's a complicated one. That's one in probably more legal in nature. My opinion, and I haven't talked it over with my attorney, but my opinion, we just signed the agreement in March to continue to phase 2. I think the state's going to be kind of upset at us that now we're saying, no, we don't want to work on the project. We should have told them that a couple months ago.
I'm not worried about them being upset at us. Does it affect the other pillars of
Yes,
the?
it does. So
Okay.
all the pillars are integrated together. So if we stop our project, so our project is the only one of the 3 projects that meets the national objective for HUD. We provide services and benefits to low-income people. And so that's what the other 2 pillars are hanging on to. They're writing off our coattails for completing the national objectives. And our money that was allocated to us, roughly $20 million, if we don't proceed in going forward, then most likely what will happen is the forest and watershed health pillar would have to stop all of their work. And the state would not have to pay back any money, because then what they would do to the biomass utilization facility, or I guess they're changing the name to the biomass utilization fund, that program would then have to, it's already a challenging program to begin with. They would then, HUD and HCD would then make them to have stricter requirements in regards to the number of jobs they would have to create for the money that or the funds they're getting to be loaned out. So those are what I anticipate would be the issues with it. Any more questions?
Just a couple comments. Thank you, Supervisor Kirk, for asking those questions. It does give maybe more clarification to the public. I think what's really difficult to quantify is the value that these facilities will have to the communities of Tuolumne and Groveland. The overall reason behind it was to create resiliency and to have something for the people to use, and to use in an emergency. And I would guess we're probably going to have 1 or 2 more along the line. And the importance that I have seen in the Groveland area to the people is they've really bought into this. They really have enjoyed being a part of the process and are looking so forward to having that. And I know that'll be utilized. And I think the figures that Mo have is going to be pretty conservative in the long run. There's another couple things that happened in the Groveland area and this is the future. I don't know what's going to happen, but we do have 2 pieces of property that we are now using for the Southside seniors, owned by the county, that we maintain, and then the Groveland Community Hall. Those could be surplus properties, depending on whether you decide to repurpose them or whatever. But the value of those, I'm going to estimate somewhere, to $400,000 or $500,000 on the combined pieces, based on what has happened in the recent past in the area. So there's money there if we need it. But I think the important thing is that we're really fulfilling a need, and it's something that we've worked really hard on, and naysayers out there that think that we won't be able to afford it. I've got faith in us, got faith in the United States of America that we're going to come out of this and we're going to be better, and those facilities will be used well. Thank you.
Thank you for those comments. I did have one question while he was talking that came up. If some of those other agencies that we're partnering with had budget issues and they weren't able to sign agreements, could we utilize it with our staff, with county staff? Or is that?
If we have, and you got to walk the line, if we have not for permanent offices, so we couldn't build it to hold or to house on a permanent basis XYZ program. But so let's do an example. I'll pick on my friend Quincy. If we wanted to do and have an office where maybe Monday, Wednesday, Friday, we have someone from the building department have office hours there, so contractors or people can be up there and meet with them, that would be okay, but we can't have anything permanent up there. If we wanted to do something where animal control has hours there for a couple hours to do some things, we could. So we could do something that's on a temporary basis, but we can't have full-fledged offices where they're there 7 days or 5 days a week, Monday through Friday.
Okay. Yeah. Thank you, Supervisor Gray, for chiming in. Like I said, it was important that we ask these questions moving forward in wake of everything that's happening. I did go back and forth a little bit with this issue, but I do feel like we have progressed into this pretty far. We signed agreements. Other pillars of this project are tied to it. I know there's some clarification we could get, but I know the tribe. I spoke with somebody from there, and I was okay. They have an economic plan for downtown Tuolumne, and this would greatly enhance it and work well and pair with it. And so I think for downtown Tuolumne, it's going to be an asset in the long run. I am concerned with anything that government builds that there's maintenance costs in the future. There's roofs 30, 40 years down the road, which cost millions, and so that's concerning, but that's with anything. This is state money. It is building it. We do have an estimate of how we're going to cover the costs operating. They may be off a little bit, plus or minus, but we're not building, in my opinion, I've even had people say it's like building another juvenile hall. It's nothing like the juvenile hall. It's nothing like a detention facility where you have mandated staff, and it's nothing like that. We're talking about an operational cost of $30,000 to $40,000 versus, $1.6 million or something. So with that, I just wanted to say thank you for bringing this. Thank you for answering my questions last minute. And I know it wasn't part of the agenda. It was just to move forward. But I wanted to make sure that we were all reminded of this information because it was important for me, and I know for a lot of constituents.
And it was a year ago in which that presentation was made, so it was
right. And we're in a whole new, different climate with the economy. So, and I think with a completion date of 2022, hopefully a lot of things will have turned back. So.
Well,
Thank
by
you.
the same token, we'll see some people may be looking for some efficiencies that they weren't before either, and these buildings may provide that. But at this time, I'd like to ask if there's any public comment.
I want to thank you for the presentation. I feel so much better about this item. My question is this something that construction-wise Tuolumne County can produce the workers to take this on instead of something out of county? Thank you.
Sure. So the question that was posed to staff was, if I understood it correctly, was can local contractors bid this project? Absolutely. The bids are open to anybody. The government process that we have to do is we will take low bids. So everyone will have an opportunity to bid on these projects and submit a proposal to us for the award of this project. And I'm hoping that local contractors come out and we'll aggressively, just like any project, go after them and ask them, make them aware of this project so we can revolve and turn this money again within inside the county, as all projects we try to do.
Is there any other public comment? All right, thank you. Bring this back.
Move on staff recommendation.
I'll second.
A motion from Supervisor Gray, a second from Supervisor Kirk. All those in favor?
Aye.
Any opposed? Motion carries 5-0. Right.
And at a future date, I will be coming before your board with the final property in regards to the Tuolumne CRC.
Okay, will the clerk please read item 20?
Consideration of approving an agreement with Adams Ashby Group for the Neighborhood Stabilization Program consulting services related to the Groveland Community Resilience Center, and recognizing $10,000 into the Federal National Stabilization Program revenue line item and corresponding expenses in the professional supplies and services consultation administration line item.
No.
Okay. As we've been discussing, upon completion of Phase 1 of the NDRC programming document, it showed that we had a shortfall of roughly $2 million. And again, as noted, HCD came to our rescue and came up with a little over $5 million with Neighborhood Stabilization Program funding to help fill that gap. One of the requirements that they had with that funding is that they wanted us to hire a consultant or a team to help us through the requirements that were necessary regarding the NSP program. If we thought that NDR had a lot of reporting requirements and conditions on it, NSP was no less than those requirements. They were even more. With that, then we accepted the NSP money, and on February 21st, the county sent out a request for proposals for NSP consulting services. At the close of the proposal process, the county received 4 proposals. They were then reviewed and ranked by the review committee consisting of Terry Cox and myself, and each one were rated based on the criteria that was set out in the RFP. Those criteria were qualifications of firm and their proposed staff, experience in working with CDBG or NSP programs, approach to building capacity for the county project team, and the cost of the proposal. The review committee is today recommending to your board that Adams Ashby Group Inc. be awarded the contract for NSP consulting services for the Groveland CRC in the amount of $191,250. The Adams Ashby Group proposal best fit what we were looking for in consultants to help us through this next phase and supporting the CRC project in Groveland. Tuolumne County has, a long time ago, had a small contract for a short amount of time with Lori Ashby in regards to our CDBG program. So she's a known quantity. She served us well when she was here with us before. So before you today is an agreement with the Adams Ashby Group for NSP consulting services. The term in the agreement will start this May and run through September 2022. Even though I just said the facility will be completed in June, there is a lot of 2022. There's a lot of additional paperwork, closeout documents, and things that the state will require. So we wanted to retain their services past the date in which the facility will be open. If your board is agreeable to awarding this NSP contract, I also need you to recognize $10,000 in federal NSP funds I need you to recognize $10,000 in federal NSP funds revenue line item with a corresponding expense in PS&S consultant administration line item for this current fiscal year. The remaining of the NSP funds, grant funds, will be then budgeted in the following two fiscal years. And again, this consultant is 100% being paid for out of NSP funding. With that, I'd just like to say again, one more time, because this is the last NDRC type project, I couldn't have done this without my cohort. She would have been here, Terry Cox. I know she's listening, so I thank her greatly for all her support and effort in all of these items. And then also to Christopher Schmidt, who a lot of times I walk in at the last minute, and he's always very gracious in helping me out and getting these things done and helping me to maintain that deadline that I have for this project. So I greatly appreciated that. So before you today is a contract with Adams Ashby Group for NSP consulting service in the amount of $190,250 and recognizing $10,000 into the federal NSP fund revenue line item with a corresponding expense in PS&S consulting administration line item for this current fiscal year.
Any board questions? Is there any public comment? Okay, I'll bring this back.
Move on staff recommendation.
Second.
I have a motion from Supervisor Gray, a second from Supervisor Rotifer. All those in favor?
Aye.
Aye. Any opposed? Motion carries 5-0.
Finally, Mo.
I know. It's good.
Thank you.
You're welcome.
And I just want to also, Mo, you thanked everyone, but I'd extend my thanks also to you. No, this has been a very challenging process to get through, and I've been on a number of these calls with you also, and your patience and just working with the core team, and so thank you.
You're welcome.
I'd also like to echo your comment about your cohort.
Yeah.
She is and I mean this in the most complimentary way possible, she's a pit bull. And we couldn't be doing this without her. So thank you very much wherever you're listening.
Okay, will the clerk please read item 21?
This is consideration of approving change order number 8 for the Sheriff's J.H. Jack Danbecker Detention Center and an extension of the construction contract to June 30th, 2020 for final completion. And if you'd like to call in for public comment, the number is 533-6581.
Okay. So this is the other project that's taking up a lot of my time, and I thank both Tracy and Eric. They have allowed me to really isolate myself and work on these two projects where they're holding down some of the budget stuff for me. So I thank them very much. In regards to the jail project before you today for consideration is change order number 8. As you know, in January 2018, the county received SB 1022 and AB 900 construction funds for the new jail project. On January 23rd, 2018, a construction contract was awarded to Harris Construction Company in the amount of little over $39 million. To date, the owner's allowance that we had in there of $200,000 has been utilized for construction changes, and we have gone through 21 weather-related delays. The construction changes that we've had to this point have been change orders 1, 2, 3, 4, 5, 6, and 7, and are attached to your board memo. before you in change order number 8 is 22 additional items. These 22 items are the result of either items that have been missed in the plans, field conditions, which means you get to the field and even though the plans are correct, it doesn't work for some form or reason. Or in Tuolumne's case, a lot of times it's because of a rock. Or the last one is owner changes, and the sheriff's office has been really diligent about it. There's several things that they would like changed, but they know that we don't have them funds for it. So if there's any changes that have been requested by them, it's really for the safety of the officers and the safety of the inmates that we're going to be housing. So these 22 items relate to those items. The change order will be funded by the project's contingency contained in the capital budget for the jail construction line item. The revised contract will be now a little over $40 million. If change order number 8 is approved, a total of $1,649,583 or 84% of your construction contingency will have been spent. And this 84% takes into consideration the CTS amendment that we just approved earlier. There will be a total of $308,267 remaining in that construction line item. The project, as I mentioned earlier, is about 90% complete. The other item that's very important that's in this change order number 8 is, and the reason it took a while to get to you, is an agreement between Harris Construction and the county as far as when they're going to be done. COVID has wreaked havoc out there at the construction site. We're all doing the best we can to keep it going. We have had an incident in which we had a whole team, I won't mention what trade it was, that had to be pulled off the site for 2 days because one of their members was being currently tested for COVID. This was a month ago. And it turned out to be negative, but still, just for the safety of everyone else out there, we're doing our best to socially distance. So some of the trades are working split shifts, or they're coming in the evening time, or they're just working on maybe a Friday, Saturday, Sunday. We have some equipment that is coming in from a plant from Mexico, and that plant is currently shut down. We have carpet and vinyl that we got the vinyl and we got the first load of the carpet tiles, but the other carpet tiles, the distributors just keep saying, well, we'll get it to you next week. Well, we'll get it to you next week. So in that regards, we, Harris and Lionakis, Moss Construction Management, and the county really have hammered out and said, okay, we will get this done. So the substantial completion date is now May 30th, 2020, and the final date of completion, all said and done, all the punch list, everything moved out, is by June 30th, 2020. So with that, staff recommends approval of change order number 8 in the amount of $74,167 and an extension of the contract term to June 30th, 2022 for final completion. And asking for myself, the Deputy County Administrator, to sign the change order.
Just one question.
Supervisor?
Yes. Prior to this coming before us, we were working with 2 completion dates, one a substantial completion and the other one was a final completion. I understand this is slipping the final completion till the end of June. I assume that there is a corresponding slip in the substantial completion, or are we going?
Right. Both of them have slipped by 1 month.
Okay, so end of May for the substantial completion.
Mm-hmm.
Thank you.
You're welcome.
Any other questions?
Yeah, thank you, Mo. What was the original completion date upon signing the original contract?
The original date was I believe October 15th. I don't think it was the 30th. I think it was October 15th of last year, 2019.
And then you mentioned 80% of contingencies have been consumed.
84%.
84%.
If this one's approved.
What's the dollar amount on that?
380. sorry. 308,267. If this is approved, you'll still have that remaining.
We'll have 308 remaining? Okay, what's the dollar figure on the change orders?
The change order
Is
amount
that the
is the
810?
no, the change order amount for number 8 for these 22 items is $74,167. That's what you're approving today.
What I'm saying is, what is the total amount of change orders 1 through, assuming 8?
So there's 8.
So change orders 1 through 8, what's the dollar amount there?
I don't know off the top of my head. I can get it for you.
Well, what was the amount of contingencies that was?
Well, the total amount was $1,649,583, but that figure, that was your whole contingency, your construction contingency. So not only did that amount go into your change orders for construction, it also has gone we've had to do, because of the delay in time, we've had to do amendments to almost all of your contracts. So we have 2 amendments with CTS, who's the special testing services. We have 1 amendment with your architects, Linakis, and 1 amendment with Moss Construction. So those contracts also come out of this fund.
So then the 308 is what remains of the 1.6?
Mm-hmm.
Okay, that's what I was trying to get at.
Sorry.
Any other questions? Is there any public comment? No public comment?
Madam Chair, I'd be glad to move on approving change order number 8 for the Sheriff J.H. Jack Dambecker Detention Center in the amount of $74,167 and approving an extension of the construction contract to June 30th, 2020 for final completion.
Second.
I have a motion from Supervisor Rotifer, a second from Supervisor Gray. All those in favor?
Aye.
Aye.
Any opposed? Motion carries 5-0. Thank you, Mo. Okay, will the clerk please read item 22?
Reports, and this is not a public comment item, so I'm not going to give you the number.
Okay. Supervisor?
Yeah, short one. We did have a Central Sierra Child Support meeting by Zoom. It's interesting to try to chair one of those meetings by not seeing everybody there, but it went well. The rest of the time, like all of us, we've been dealing with COVID and constituents' worry and problems, and I have to comment that staff has done a wonderful job. I mean, if I need an answer, I get it really quickly. So that's my report.
So my report, I did attend an ATCA Zoom meeting along with, I believe, Supervisor Campbell. Other than that, I've been working COVID pretty much all day, every day. And my light reading as I get ready to go to sleep at night is every medical professional's opinion of COVID and how to deal with it that I can find. And I can tell you that there are equally learned medical and public health professionals on every part of the spectrum out there, publishing like crazy. And it is very difficult to sort through the various opinions. So we're doing our very best, and I have to, again, commend our public health staff, our health and human services staff across the board. This is a most difficult time, and, well, actually our entire staff, because there's a lot of people that are working this problem with our health and public health staffs as well. This is a very difficult time. It's very hard to get to ground truth, but I think we're doing as good a job as we possibly can. And again, thank you to everybody in our government that is contributing to the way ahead, and I look forward to that. I believe if we do this right, that we can get through this, but we need to get through it together, as I've said in any number of blogs and forums. So let's hang in there together, Tuolumne County, and let's do it right. Thank you.
Supervisor.
Yeah, I attended both of the aforementioned meetings with Supervisors Gray and Rotifer. And like everyone else here, the majority of my time has been consumed with COVID-19 planning. I wanted to kind of applaud Supervisor Rotifer and Cole Presberlaw, our Innovation Director, on their efforts to coordinate some of the concerns within the business community. And kind of in that vein, I've been trying to coordinate members of our schools and childcare sector, as well as those who represent vulnerable populations. I also want to thank the superintendent of schools for her work in this regard. And the idea with this is planning for what the future is going to look like in Tuolumne County. Right now, there are resources available to families that are struggling. Now, of course, it's a very difficult time for everyone, but there are some resources available. Unemployment, potentially, people will get stimulus checks, but those won't last forever. And so depending on how long our economy struggles, depending on how long businesses are closed and individuals are out of work, we're going to need to come up with a plan. And so that's the bedrock idea for coordinating these service sector groups and childcare, is to find out what is our community going to look like in 2 months, in 4 months, next year. We need to have a plan. And so that's what I'm working on, trying to get that plan together, trying to coordinate families and resources and get them connected together for the long haul. So,
Thank you.
thank you.
Supervisor.
Well, just like everybody else, we're doing all our meetings Zoom. I didn't write down all the meetings I was in, but plenty of them, and working out the technical difficulties. Like Supervisor Campbell stated, I want to thank Carl Prisabella, even thank Supervisor Campbell for them hitting up the business sectors, but then also, like Campbell said, with education, with childcare, what it's going to look like in the future. I know it's a big undertaking, so thank you guys for doing that. Yeah, I don't know if this is report time or personal opinion time, but I know we're going to have to face some music here pretty quick, look at the numbers, and I know the business owners have plans, and they're anxious to implement them and to start opening. And this week will be very telling. Newsom has gone from talking about months to weeks, and then weeks to days. So I think hopefully his office is seeing some of these numbers, like this chart that we looked at this morning. And I think we're entering an era where we're realizing COVID's with us, and we're going to start having to learn how to live with it and use personal responsibility, personal hygiene, social distancing. I know I'm going to be wearing a face mask. But like Supervisor Rotifer said, there's so much information coming from so many angles, and we're going to have to come together and work this out together. And it's going to have to happen very soon, because I know we're all at that breaking point, and we've been at that breaking point for, I think, 2 or 3 weeks. So hang in there. Let's see what happens this weekend and or this week with Newsom. But based on the information I'm seeing, I feel change is coming. So I'm hopeful for a change this week. So thank you.
Ms. Riggs. Ms. Carrillo. All right. Going to wrap this up. As the other supervisors have said, we still are attending numerous meetings by Zoom, but the couple that I want to highlight are around forest health, forest management, vegetation management. The governor's Forest Management Task Force has morphed into his Government for Forest Health. And that's really looking at SRA as well as other jurisdictions, U.S. Forest Service, Bureau of Land Management. They continue to meet, and I guess my message to the public is this fire season is just around the corner. We have met with our local preparedness team. I know that I believe as of May 1st, burn permits are now required. I want to really encourage the public to do what you need to do to start preparing for fire season. Clean up around your homes, do the necessary vegetation management. We will be coming out with more educational materials, but now is the time. Like I said, I think within probably a week to 10 days, we can look around and see the grass is turning rapidly. And so be looking for materials that will be coming out on how you can be prepared, what you need to do. And we need to be addressing this now. So with that, I would ask that the clerk please read our 2 closed session items.
So they're closed sessions, conference with labor negotiators, Tracy Riggs, Eric Earhart, and from Kim Phipps. Authority Government Code Section 54957.6, all bargaining units. And then conference with legal counsel, existing litigation. Authority Government Code Section 54956.9D1 is Diana Rios versus County of Tuolumne, Stanislaus County Superior Court case number CV 2001942.
Do we anticipate a report out?
Yes, on the closed session litigation item.
All right, we will be working through lunch, and I'd ask at this time if there is any public comment. Seeing none, we will recess into closed session.